Governor Morris sitting down and saying, we need a preamble, so we just put one out. In there, he used a lot of words that have since been abused by the Supreme Court for 200 years. Then we got John Marshall, who kind of does the original sin, and kind of makes it up a couple of times. Since then, my thesis is we've ceased being a country governed by the Constitution as written. We've become a country governed by a compilation of Supreme Court case law a la the United Kingdom. And when push comes to shove, the accumulated case law subject to the opinion of 5 priests in black robes wins, regardless of the point you want to raise in the amendment. Where am I wrong?
You are not only not wrong, you are absolutely right. One of the things when you go to law school, you read voracious amounts of material. One thing that you can get through law school without reading at all is the United States Constitution. All you read are cases interpreting the Constitution, which I think is a horrible tragedy, and maybe one of the explanations for why I did so awfully in law school. But we now have justices who are willing to go back to the original document. And one in particular, who we were just talking about a few minutes ago, Clarence Thomas. If you want to have a really cool history lesson, read his concurring opinion in the recent McDonald gun rights case. One of the things I love about Clarence Thomas, and I'm happy to call him a very dear friend, is that he begins every constitutional case by going back to the original document and seeing how it's been interpreted, and then saying, have we been interpreting it in fidelity with the Constitution? Just having even one justice who goes through that exercise makes a tremendous difference and helps keep the other justices somewhat intellectually honest. That has happened in 2 areas that are very relevant to what we're talking about today. One is federalism, the idea that the federal government has very specific, enumerated, limited powers, and the states have the rest of those powers. And the second is the original meaning of the Commerce Clause. This court is not there yet, but it's moving in the right direction. And so I'm hoping that it will be receptive to the kinds of arguments that I am very philosophically oriented, but at my core I am a real pragmatist, and won't try anything I don't think can win. Any others? Or I welcome our distant viewers. Any other questions here?
I'm Sharon Ullman. I'm an Ada County commissioner, and one of the issues that I think a lot of people don't understand is that we already have socialized medicine, that if you have something go wrong, you don't have the means to pay, and you don't have insurance, you can walk through the doors of an emergency room and get medical care. To me, the system is absolutely broken already, just in how it functions, and Obama is going to get another layer of regulation on top of that. Have you looked at the healthcare issue itself, and how do we fix this system in the country? You know, I'm looking in the state of Idaho, how can we correct it using students, university students to provide preventive screenings and try to get people into preventive care, personal responsibility. And at some point, can we as a society, do you think, say that if you've smoked for 30 years and you get lung cancer, we as taxpayers are not going to pay for your cure?
That's a terrific question. Essentially, what would an alternative be? And I am not an expert on healthcare, but through practical experience, I've seen a system that works. And unfortunately, Obamacare will allow much less state experimentation than currently exists. For example, Arizona has a waiver in its Medicaid program that allows us to have a much more competitive system than the default federal system. But Obamacare is really going to limit this. But for almost all of my career, I have had a gold-plated healthcare system. And so if my kids got sick, you know, a head cold, they're at the doctor's office. This is not rational economic behavior, except that I'm not footing the bill for it. So what's the difference? Well, at the Goldwater Institute, we have a health savings account, which basically combines a catastrophic health insurance policy. So if you get really sick, you're covered. And then they partially fund, and then the rest individuals can fund in a tax-deductible manner, a health savings account where you directly pay the doctor for the cost of your medical care. And then the insurance company also negotiates rate reductions and discounts with pharmacies and that sort of thing. This has turned me into a market consumer. I am now aware of the breathtaking cost of some of the drugs, some of the medications that I've taken. I know what physicians cost, and the physicians are competing for my business now. And when Obamacare talks about reducing costs, that is a joke. It is a really awful joke. Health savings accounts do reduce costs by putting the person who has the greatest control over whether medical expenses are incurred in a position of responsibility. If you don't use that money for a medical expense, you get to keep it. You get to keep it for your retirement or for education or whatever down the line. If you pair that with abolishing the trade barriers between the states so that we could do with health insurance the same thing that we do with life insurance. I can buy life insurance in any state in the country. It is dirt cheap. I've never heard health insurance anywhere be called dirt cheap. These are the market prerequisites, and Obamacare goes in exactly the opposite direction. And if you wanted to cover the people who were not covered, all you would have had to do was to have government make payments into health savings accounts for individuals. And you could have covered the uninsured people. They wouldn't be going to the emergency clinic because guess what? That will wipe out their account. If they wait until Monday and go to a regular doctor, it would not. So we had a market solution at our fingertips. We did not use it. Republicans did not get out in front on this issue. I am hoping that that we still have time to get out and take on that issue. Let me go to the back and then I'll return to that.
Wasn't that in the Republican alternative? The
Yes.
Expansion of health medical savings account? I thought it was. And had
Yes.
Had some votes too, but it had quite a significant enhancement to medical savings.
Yes, and I think what's the expression? A dollar short and a day late or something like that. You know, by the time Obamacare came up, the Republicans really did have, in my opinion, a very credible alternative that included tort reform as well. But you know, it's an issue that the Republicans, when they were in power, simply were not that serious about, and as a result, just left the terrain open for
Is
Obama.
not health savings account one of the elements that is being fought significantly, not only by government, but also being fought by health institutions, doctors and hospitals, pay health savings.
That's right.
They don't want to be accountable to the patients.
That's right. You know, in this battle, consumers are almost all alone. We cannot count on, you know, many doctors have similar interests to consumers, but in terms of corporate America, we're really in this fight alone. And that's why, you know, if you've looked at the price of health insurance company stocks since Obamacare, they've done just fine. And it's because they've made a deal that they're happy with. It's the rest of us that aren't going to work out too well.
Yeah. Addressing this point, first thing, the source would be Dick Harvey of Freedom Works.